Hello, and thank you for joining us today for this webinar on the state of your health, how new laws may impact you. My name is Mary Bartlett, and I'm a State Director of Advocacy and Access for the Arthritis Foundation. Arthritis Foundation Advocates have played a pivotal role in more than 100 state legislative victories across the country since 2014, including the new law on step therapy in West Virginia. But what do these victories mean for patients and their access to care? The Arthritis Foundation has you covered as your go-to resource to learn more about the benefits of these new and improved changes in law. We are here to help ensure that your new protections are implemented fully and that patients in your state know their new rights. This includes providing resources like this webinar that explain the issue, the new law, and what it means to patients. The purpose of this video is to learn more about the new step therapy law in West Virginia that was fully implemented in June 2017, and what to do if you feel the law has been violated. First, let's define step therapy. Step therapy is a protocol or program that establishes the specific sequence in which prescription drugs for a specific medical condition and medically appropriate for the patient are covered by a health plan insurer. We had amazing champions in the West Virginia legislature on the step therapy bill. A huge thank you to each of those legislators. Now that there is a law in West Virginia on step therapy, we want to make sure you know what that means. This law requires health benefit plans to have a clear and convenient process by which a patient or prescribing healthcare provider may request, and if appropriate, receive an exemption to a step therapy protocol. The process must be easily accessible on the health plan insurer's website. There are a few reasons a request for exemption to the step therapy protocol must be promptly approved by the health plan insurer. They include a drug being contraindicated, a drug expecting to be ineffective, a patient previously trying the drug and it was discontinued, a drug not being in the best interest of the patient, or a patient is already stable on a prescribed medication. But what else does the law provide for? The health plan issuer is required to provide a prescription drug for treatment of the medical condition at least until the step therapy determination is made. Upon approval of the step therapy exception, the health plan issuer must authorize coverage for a prescription drug prescribed by the patient's treating healthcare provider, as long as such prescription drug is a covered drug under the policy or contract. Who benefits from this new law? Generally, a person with a health benefit plan that includes prescription drug benefits and utilizes step therapy protocols benefits from this law. To learn if you are covered, contact your insurer and provide your policy number. What do you do if your prescription is denied? If your medication is denied because of step therapy, your insurance won't cover the prescription. At this point, you may want to talk to your pharmacist and healthcare provider about alternatives that would be covered. You can also decide to pay out of pocket and compare discount cards, cash prices, and assistance programs to determine what works best for you. To start the appeals process, ask your pharmacist what they heard from the insurance company and write it down. Call your doctor and report the problem. See if they can suggest next steps to get your medication. Call your insurance company and find out how to appeal the decision. Your physician often needs to intervene and write a letter. Remember to share copies of any insurance letters or information you receive with your doctor. Make sure you stay on the same page. Here are some tips for working with your insurance company. Check with your Human Resources office to learn the specific rules of your plan. Then, check to see what measures your physician has already taken with the insurance company. If nothing has worked, you may need to appeal the insurance company's decision. Call your insurance company to find out why your medication did not receive approval. The number to call should be on your insurance card. Find out if your appeals need to be done online or if there's another process from your insurer. Remember to keep notes of all the conversations you have. Write down who you speak with, dates and times of the calls, case reference numbers. Having good records helps move future calls forward. Stay in touch with your doctor throughout the process and share any information you receive. Your insurance company must provide the reason for your denial in writing. Ask about that if you have not received anything. If you're submitting an appeal for yourself, include all relevant documents that may help your case. Letters of support from physicians, test results, and your personal narrative can all help. What do you do if your insurance company is still not compliant? Consider filing a complaint to the insurance commissioner. You can reach out via email or telephone. Here, we've provided the website and the phone number for the West Virginia Insurance Commissioner. But remember, before you can request an external review, you must have completed the internal review process provided by your insurance company and receive a final decision. If you have any questions or need additional information, all of our resources will be available on the Arthritis Foundation's advocacy webpage. If you have additional coverage questions, we encourage you to visit Your Coverage and Care through Prescription for Access. This go-to resource will help you better understand health coverage options, determine how your current plan meets your arthritis care needs, and guide you through the claims denial process. The kit includes information, tips, and tools for consumers to get the most coverage and avoid or minimize claim denials. The kit includes step-by-step instructions, sample letters, and consumer assistance information to guide users through the appeal process. Additionally, the Arthritis Foundation's helpline provides people with arthritis, especially those most vulnerable, targeted solutions to inquiries about arthritis and its management. The phones are staffed by licensed clinical social workers who provide expert answers to questions about access to healthcare, information about resources to pay for medication, and community resources. We thank you for listening to today's webinar, as we want to make sure the new state laws are being implemented fully so patients can enjoy their new protections.